Thank you, Mr. Chairman. Thank you for inviting me. It's a pleasure to be here. What I'm going to do today is give you some results from the study that we've been doing. But before that, I'm going to do a little bit of scene setting. Most of you in this room, from your backgrounds, will probably be reasonably au fait with the measurement of weight, BMI, those types of anthropometric measurements. Most of you, from what you do, will probably know your own weight. Can you put your hand up if you know your weight? Good. Can you put your hand up if you know your VO2 max? Okay, you're my student, you're not allowed. Okay, so we've got 2 or 3. Your VO2 max is your measurement of oxygen consumption, how fit you are. Basically, it's a multi-system measurement of how efficient and how well your body is working. But nobody seems to know theirs. What I'm going to do is give you some try and convince you that measurement of fitness is as important, if not even more important, than the measurement of weight. And then I'll give you some results, the bad news, and then I'll hopefully give you some hope, a ray of light at the end of my presentation. I'm not going to talk particularly about the obesity epidemic. You see, you can get strategy documents, you can drown in them on the internet, you can get lovely pictures of people who are obese as well and look around the country and see where the problems are. Over in Essex, in Colchester, in this part of the country over here, we're not actually too bad. What I am going to talk about is the difference between fitness and fatness. So this is a graph that I use a lot in teaching, I use a lot in presentations. It takes a little bit of explaining. What we have here on the y-axis is the odds of all-cause mortality. Okay, we're all going to die, so this is actually premature mortality. Here, you have people who are non-fat and classified as fit. So they have a BMI below 25 and they have a VO2 max of about 35 mils. They could basically run on a treadmill quite comfortably. These are our reference category. So we give them the odds of 1. Okay, that's your reference. On the bottom axis here, this is where we want to be, obviously. On the bottom axis here, we have people who are fit, but they're also overweight. They are at no higher risk of an adverse event, in this case mortality. They have no greater health risk than the people who are thin, because they are fit. On this axis up here, we have the people who are fit or unfit. And you see that the risk, independent of body weight, fat or non-fat here, is roughly doubled. These data are about 6 years old. They are one of about 40 peer-reviewed publications which clearly show that if you are fit, you're probably healthy, and this is independent of whether you are fat or not. Now, I'm a sports scientist by trade, so this is our bread and butter. But getting this message into the public health auditorium has been rather difficult. And it's one of the things that we set out to do. Another thing that I set out to do when I started my research was to draw attention to the differences between fitness and physical activity. They're often bunched together. These are some meta-analytical data. I'm sorry this is all a bit numbery and sciencey, but they're huge numbers of person years of follow-up. So 2.25 million for physical activity and about over 250,000 for fitness. So over on the left-hand side here, you have either the least fit or the least active, and this is the physical activity line. Over on the right-hand side, we have the most fit. So as you can see, there's a nice, almost linear dose response. The more active you are, the lower your relative risk of cardiovascular disease. So there's nothing new there. We've known this since Morris and his bus conductors in the 1950s. But the response is linear, and the reduction is about 30%. If we add fitness to that graph instead, what we see is 2 things. First, it is better to be physically fit than it is to be physically active. Now, of course, these two are related. The thing about physical fitness is you can't lie about your fitness, or you can't mislead yourself as you can about your physical activity. The Health Survey for England results for last year were probably, I think, the most important health survey that we had, where we finally monitored some fitness measurements, finally did objective physical activity monitoring, and suddenly the illusion that about 36% of the population were meeting physical activity requirements was shot out the window. With accelerometry, it turned out to be only 6% of the population. The other important thing is the shape of this curve. You don't have to be an athlete. These are athletes, these are recreational athletes, club athletes. All you have to do is get out of the bottom 25%. The most benefit you get from fitness is in the initial movement from being very unfit to being just slightly fit. And getting this public perception of fitness as not having to be super fit an athlete, just having to be able to basically jog or walk briskly if you're over 50 is something that we also need to do. The way I see the world is like this. Fitness and fatness should both be regarded as outcome measures, but I think fitness should be prioritised. Physical activity is important, but we just regard this as a behaviour. It's a target for change. We change fatness and fitness through physical activity, but it shouldn't be an outcome. We shouldn't keep asking people, do you now believe you are more physically active than you were 6 months ago? Because they will simply say yes. We need to change physical activity, but what we should do is measure fitness. If anyone in this room has ever tried to lose weight and been unsuccessful, you're not alone. Okay, I meet loads of people in my work who've tried to lose weight and haven't managed to do it. This is from children through to elderly people in our cardiac rehab clinic. I've never met anyone who has started a physical activity program who hasn't got fitter. Fitness is very reactive, whereas BMI, particularly BMI, but weight itself can actually be rather stagnant. So this is why we started the East of England Healthy Heart Study. We've measured about 8,000 children in schools in the East of England. We go in, we do measure BMI, we measure waist circumference, we measure how strong they are with hand grip. We do ask them about their physical activity, about their some dietary habits, all sorts of information, and we measure their fitness. We measure their fitness using the multi-stage shuttle run test, or the bleep test as it's known. And I'll come to a little more detail on that in a minute. Just to put into context our fit-fat problem, if you like, the good news is about 60% of children are lean and fit. Okay, that's good news. But the next biggest category we have is children who are fat, according to the International Obesity Task Force definition, yet fit. 16% of the population. And overall, across here, 30% of the population are misclassified, if you like, by BMI, because there are 12% who, although they're lean, are actually very unfit. So we're talking about a significant proportion of the population whose BMI would tell you there's either something wrong, there'd be a false positive, or something is not wrong, there'd be a false negative. So it's quite important. As I said, we measured this using the shuttle run test. And one of the things we were able to do was to take some data from 10 years ago collected by what was then Sport Chelmsford, obviously these have now been amalgamated back into Sport England, and look at 10-year secular declines in cardiorespiratory fitness. You can read it. It's a very dry academic title. I don't like that title. I think The Sun nailed it when they said idle kids fit shame. I never said that my children only walk as far as their cars. That's not quite true. We made it to page 19, right next to Andy Murray's new car. A very proud day at the University of Essex. So, we managed to look at 10-year changes. Now, the reason for doing this is because, first of all, because of our interest in fitness, but we also knew from the literature that there'd been a global fitness change. A paper published in Sports Medicine showed that, in 2003, showed that there'd been a 4% per decade decline over the past 20 years. That's quite a big decline. I'll come to some anaerobic or strength measures later, but there's also been no real evidence for a change in anaerobic. So we'll just go back to the 4% decline. So we're looking at 10 years, we expect a 4% decline. We got these kids to do the 20-metre shuttle run test. For those who don't know what it is, you put cones 20 metres apart, you put an annoying CD on that bleeps, and they have to run in time. It starts off very slow, gets faster and faster, and the children run until they can't run anymore. It's maximal, and it's quite exhausting for them. They have to try very hard. One of the major problems is people say, oh, maybe they don't try. Sorry, there's quite a lot of numbers on here. You only have to look at one here at the bottom. These are the heart rates for the kids who are running the test. These are other kids. These are 12 and 13-year-olds. They get their heart rates up to 196. So that's a heart rate that you and I probably couldn't even dream of. And the confidence intervals are 194 to 198. So 95% of kids get a heart rate well above 190 beats per minute. They try really hard. There's a natural competitiveness in children. We did our research in Chelmsford because that's where the data had been collected previously. On the axis up and down here, you see that Chelmsford is one of the least deprived areas in the country.